And I just hit go live. So the meeting is now streaming to YouTube. I don't think so. I see caption test, all good. Got it.
Hello, everyone, and welcome. On behalf of the U.S. Census Bureau, the U.S. Department of Health and Human Services, and all our collaborators, we are thrilled to kick off the TOPx COVID-19 Virtual Solutions Showcase. My name is Drew Zachary, and I am co-founder and director of the Opportunity Project and managing director of Census Open Innovation Labs. Over the next few hours, we'll hear from more than a dozen collaborators and stakeholders, and this showcase will cover a broad range of topics. We'll highlight the results of a recent technology development sprint, talk about the importance of open government, and of course, focus on COVID-19 response. Some people tuning in may be familiar with teams hosting this event and the Opportunity Project, but in case you're not, we'll start with some background. For those of you less familiar, the Opportunity Project, or TOP, is an innovation program run by our team at the U.S. Census Bureau. TOP works through technology development sprints that bring together communities, technologists, and government to co-create digital products that solve our nation's most pressing challenges with open data. But TOP is also a growing movement across many government agencies and even states and cities. Over the past few years, technology development sprints have become common at many agencies, like the Consumer Financial Protection Bureau, the Department of Labor, and especially with our colleagues at HHS. So at the end of last year, we launched TOPx, a toolkit and an initiative to enable any agency to leverage the TOP model. Over the past 4 months, we've teamed up with our colleagues at HHS to run a first of its kind TOPx tech development sprint, and we're here today to see the results. One of the things that was so unique about this effort is that we adapted to the needs of HHS and the challenge at hand, the incredible urgency of responding to COVID-19. And that brings us to the topic of the work we're showcasing today, secure transmission and reporting of COVID-19 diagnostic data. Looking back on this past very challenging year, the technological and medical advancements that took place are astounding. COVID-19 tests emerged for the first time, have now become incredibly common, and have developed in many different test types and locations. If you've had to take one, you may be familiar with waiting a few hours or days and then receiving an email with the results. However, what you may not have thought as much about is that all of these COVID test results also represent a huge amount of extremely valuable data. As tests become more accessible at home, in schools, in stadiums, and elsewhere, this information needs to get not only to the patients themselves, but also to their care providers, businesses, and public health officials quickly, securely, and accurately. And that's because this information is essential to help address virus spread, develop plans for reopening, and equip patients with the data critical to their health and daily lives. So over the past several months, our teams at Census and HHS facilitated a TOPx tech sprint in which 12 teams built digital products to address this very challenge, COVID-19 data collection and reporting. You'll hear us refer to this effort throughout the talks today as TOPx. Today, we'll celebrate the incredible work of the teams who participated in this sprint and launched tools into the market extremely rapidly and transparently. And now to give you a preview of the agenda for the next few hours, first, you'll hear welcome remarks from government leadership. Then you'll hear from 6 tech teams who built products in the sprint, introduced by community leaders who will discuss the importance of data and technology on the ground. We'll hear from a cross-sector panel on what's next for COVID response and for these tech products, followed by a closing keynote from former US Chief Data Scientist, DJ Patil. Then join us for interactive live demos from the tech teams where you'll have the opportunity to see the products firsthand and engage directly with the teams who built them. We encourage you to share questions or comments in the YouTube live stream, where a member of our team will be monitoring. You can also visit waters.crowdicity.com to learn more about the background of today's session and connect with the teams you hear from today, as well as opportunity.census.gov to learn more about the Opportunity Project. And please, we encourage you to post about the event on social media using hashtag TOPxCOVID and hashtag Opportunity Project. Next, I am thrilled to turn it over to the 2 amazing women who spearheaded this effort for HHS, Dr. Sara Brenner and Dr. Kristen Honey. First, Dr. Brenner, who holds many impressive titles. She is Associate Director for Medical Affairs and Chief Medical Officer for In Vitro Diagnostics at the US Food and Drug Administration and the Diagnostic Data Lead for the National COVID-19 response at HHS. She'll share more on the story behind this important challenge. And Sara, I'll turn it over to you now.
Thank you so much, Drew, and thank you to everyone for joining us today. I was first introduced to the Opportunity Project back in 2018 when the White House Office of Science and Technology Policy collaborated with the Census Bureau on a tech development sprint focused on the opioid crisis. I was the senior policy advisor for health and biomedical technology at that time, and the opioid crisis had recently been declared a top national public health priority by the administration. That sprint resulted in the development of 3 new digital products to harness federal open data to help individuals and support organizations to combat that crisis. And I saw the critical role this type of open collaborative process could play in addressing large, complex national challenges. So last spring, as the COVID-19 pandemic began sweeping the nation at full force, the race to develop and deploy COVID-19 diagnostics, or tests, was moving at breakneck pace to try to keep up with and get ahead of the spread of the disease. A surge in new testing technologies, an increase in the volume of testing, quickly gave rise to an unprecedented need to manage testing data. To give you some context, the purpose of performing a diagnostic test is to generate a result, along with a core set of data about the patient, and get that information to where it needs to go, to the patient and their physician to guide clinical care, and to state and federal public health authorities to guide public health decision-making, including policies about things like opening and closing schools, businesses, travel, and other key aspects of society. The current public health data infrastructure was not designed to handle a once-in-a-century pandemic's worth of data. So we urgently began building networks and systems to manage a rapid influx and new types of diagnostic data. I cannot overemphasize the importance of making diagnostic data accessible and usable in real time during a situation like we're facing now with COVID-19. We need high quality, harmonized, or interoperable, comprehensive data to track the spread of the disease, stop transmission, and save lives. As manufacturers stepped up really quickly to develop needed diagnostic tests, we also needed to ensure that diagnostic data was getting to all the people who needed it to make evidence-based decisions as quickly as possible. So by fall 2020, we were confronted with another critical challenge, the need to expand access to testing and for tests to return results more quickly drove the development of non-lab-based tests, meaning those that could be performed outside of labs or at points of care, places like drive-through sites, workplaces, nursing homes, schools, et cetera, and over-the-counter tests, those that could be bought at a pharmacy, for example, without a prescription and be taken at home or anywhere the patient would choose. These new at-anywhere diagnostic tests represent an exciting new frontier in diagnostic technologies. And FDA has played a critical role working with developers to bring safe and effective products like this to market so patients can do tests on themselves anywhere. But at the same time, once a test is untethered from a lab or other clinical setting, obtaining and transmitting the test result and other core data becomes a big challenge. So this gap created by the increasing use of non-lab-based diagnostic tests creates both a challenge in terms of data capture, but also an opportunity for innovation. What we saw very early on were a few things that needed to be urgently addressed. First, as non-lab-based testing increased, we would be receiving less and less of the total testing data overall if we couldn't capture it, meaning our aperture on the pandemic would be shrinking quickly. Second, the solution would require data standards and a combination of policy and innovation at the device or test level, and also in terms of the larger scale data infrastructure. What we needed for at-anywhere diagnostics to be able to do was to automatically capture, wirelessly transmit, and securely share data in real time with public health authorities and other key stakeholders. Now, this was a big ask. Diagnostic devices and tests had not previously been coupled with digital applications or software tools that could do this, but this was necessary to allow for seamless, secure movement and use of data. We also needed to quickly build an information superhighway to handle all of this data that was flowing wirelessly from everywhere. We needed both a pitcher and a catcher in order to play ball. I knew TOPx would be a perfect solution to address this unfolding complex challenge that we were seeing with diagnostic data by catalyzing the development of digital products through an open technology sprint to ensure that these data would be efficiently, securely, and accurately transmitted to federal and state public health authorities who vitally needed the data and yet other information to coordinate the national response. Not only was this data critical at the federal level, but equally important on the ground. State and local governments needed it to address the spread of disease locally and effectively coordinate with key stakeholders. Schools, employers, and businesses needed the data to make decisions around reopening, sustaining their operations. As we saw COVID-19 test results being increasingly available on the spot or at anywhere, key stakeholders also needed digital products to help them manage and share this information with schools, workplaces, and for travel purposes. These are exactly the types of challenges that the 12 teams who participated in the TOPx sprint developed tools to address. The TOPx process followed on a 2-week COVID-19 Design-a-thon that was hosted by HHS and FDA back in the fall of 2020. So the winning teams from that event had already been through an initial round of innovation and matchmaking. They were able to hit the ground running this spring for TOPx. The support provided by the Census Bureau and other federal participants were invaluable as teams raced to continue building, piloting, and launching their products. What they've been able to accomplish and bring to patients in such a short period of time is incredible. Today you'll hear from these teams through lightning talks and live demos and see firsthand the ways in which these tools set out to empower key stakeholders to manage the virus. In addition to supporting the data needs of the pandemic at every level, these tools also greatly contribute to the user or the patient experience of testing. They help to ensure patients are using tests correctly, for example, through video instruction. And they also help patients know what to do with the results, including what to do immediately while waiting to be connected to a clinical provider for their own medical care. Diagnostic devices coupled with digital technologies are truly a game changer for patients, physicians, and public health professionals. I'd also like to take a brief moment and highlight a true public health hero and key architect of the events that you'll be hearing about. My FDA colleague, Dr. Michael Waters, spent his career in public service, including as a Marine veteran. He and I jumped into the COVID-19 response at the very beginning, January 2020. Tragically, however, we lost Mike last fall in September of 2020 at the zenith of his career. In the months, weeks, days, and hours prior to his untimely passing, Mike was a passionate and enthusiastic champion of diagnostic data harmonization and quality. He worked tirelessly to fight the pandemic, bringing his technical brilliance, innovative insights, unwavering commitment, dedication, and spirit of service to each and every discussion. He is missed dearly by our team, by his friends, family, colleagues across the country. We hope to honor his memory, legacy, and contribution to public health, diagnostics, and data through continuation and elevation of his work, including naming the new diagnostic data information superhighway that's being built after him. You'll hear more about WATERS, or the Wireless Automated Transmission for Electronic Reporting Systems, throughout the day today. We hope the world knows of Mike's incredible sacrifice and is inspired by what he contributed to the pandemic response and to our country over the course of his short life. Next, I will turn it over to my colleague, Dr. Kristen Honey, Chief Data Scientist and lead for the COVID-19 Diagnostics Informatics project at HHS. Kristen will share more on how we have worked collaboratively to engage the public and these technology teams in response to the pandemic. I'm delighted to turn it over to you, my friend and colleague, Dr. Kristen Honey.
Thank you so much, Sara, and everyone, thank you for being here. As Sara mentioned, back in November and December 2020, our HHS team launched the COVID-19 at Anywhere Diagnostics Design-a-thon, an innovation sprint. And the purpose of this Design-a-thon was to crowdsource and identify digital tools for COVID diagnostics, recognizing that collaboration is not just a whole of government response, but really a whole of society response. And many of the digital tools and solutions probably are going to happen outside of federal government. So we wanted to use some of the best innovation methods where innovation will achieve multiple goals at the same time, simultaneously doing, getting diverse people together. And our three goals that we kind of pushed down the field through this Design-a-thon were: one, to improve speed, utility, and comprehensiveness of data collected through diagnostic tests. Number two, to develop user-friendly software and digital tools to enable the flow of data, even when testing was done outside of lab settings, for example, in schools or nursing homes, or even in the comfort of your own home. And then third was to ensure this data was not only captured, but it was also sent to public health authorities, healthcare providers, and patients quickly and securely, so that this information could get in the hands of decision makers on the front lines making decisions about the COVID response. With our COVID-19 Design-a-thon, nearly 700 participants participated. They came from government, industry, academia, nonprofits, from all walks of life. And they joined together on our crowdsourcing platform, named after Michael Waters, waters.crowdicity.com. And this waters.crowdicity.com community allowed us to operate in the open with the public in a transparent way. Out of the 700 solvers who joined us, there were 31 capstone projects submitted at the end of our innovation sprint. And a panel of judges evaluated the 31 submissions and selected 15 based on 7 criteria. And the 16 teams will join us for this COVID-19 TOPx technology sprint, where we're showcasing the solutions today. The judges evaluated the teams with the 7 criteria, which were: 1, alignment with the challenge goals, so addressing the challenge that we put forth; feasibility of their solutions; the design of their proposed solution; innovation; flexibility and scalability; sustainability; and lastly, collaboration, because this COVID response truly is a team sport. In addition to the 15 teams that the judges selected, we also opened up our innovation crowdsourcing platform for the power of the crowd to select their favorite submission. So there was a People's Choice winner. And these 16 winning teams went on and were invited to join us for the COVID-19 TOPx Tech Sprint. And during that sprint, the waters.crowdicity.com grew even more to nearly 1,000 participants. And for those watching today, if you're not a part of waters.crowdicity.com, we encourage you to join and follow up innovation and future sprints. So this TOPx sprint was the first ever HHS TOPx sprint that focused on COVID-19. We launched in January 2021, and we did a couple things differently compared to past TOP sprints run by the Obama White House and the Census Bureau. If you're familiar with other TOP tech sprints, they're usually a 12 to 14 week build cycle, and the teams will sign NDAs and then launch all together in one big cohort. But we decided with COVID that there were 2 things that were different about this COVID tech sprint. One is time was of the essence. We didn't have 12 to 14 weeks for solutions. We needed them yesterday. So we condensed the build cycle to 2 months rather than three or 3.5 months. So it was a faster paced sprint. Secondly, we recognize that trust in government, trust in science, trust in data was at an all-point low. And to improve that, we thought we can work in the open, work transparently. So let's have everything we do with our COVID-19 TOPx sprint be done with the public invited to have a front row seat and work with us. So all of our demos, all of our subject matter experts discussions, all of the different meetings we had were purely, they were virtual, but open to everyone, with the hope that that open engagement consistently over time would increase trust in our process and in the outcomes of this sprint. And then in addition to working with the tech teams, which were industry-led, and they all developed their own digital tools, we onboarded the teams to the Waters platform. And this allowed their diagnostics data collected by industry and outside groups to seamlessly flow from their digital devices to federal health authorities at HHS and CDC and back to state health authorities. You'll again hear more about Waters later today throughout the day. Our Innovation X team is using this tech sprint as a pilot, and we're currently using this in our experience here to develop an HHS TOPx toolkit that will allow the other 80,000 plus HHS employees to replicate these innovation methods. This HHS TOPx toolkit will include HHS case studies and very detailed how-to methods using healthdata.gov, the home of HHS open data, for future tech sprints at the department. We're excited to see how many applications of this TOPx approach across HHS on timely public health challenges like mental health and climate health equity can move the needle on other complex issues that are a priority to this administration and to the public. And now, with that, what better way to kick off our day than to hear from Dr. Micky Tripathi, who is the HHS National Coordinator for Health IT Technology. He has been a tremendous champion of our work. Dr. Tripathi leads the formulation of federal health IT strategy and coordinates federal health IT policies, standards, programs, and investments. He has over 20 years of experience across the health IT landscape, most recently serving as the Chief Alliance Officer for Arcadia, a healthcare data and software company focused on population health management and value-based care. Thank you for being here, and welcome, Micky.
Thanks so much, Kristen. Just delighted to be here, and welcome to everyone. First off, I just want to begin by thanking Kristen, Honey, and Sara Brenner for tremendous partnership and friendship over the few months that I've gotten to know them since I started on January 20th. But more important, just for being trailblazers in this whole area. It's just been fabulous to watch and participate in, and I'm just really delighted to have you as colleagues. So the first thing is you may notice that I'm in my hoodie. This morning I was looking at my schedule and thinking, oh, I better change. I'm going to be speaking at a great event, and thought this is the event that I can wear my hoodie. Actually, I don't have to change. So that's why I'm in my hoodie today. I am just really delighted to be here, and we're really happy. We at ONC are really happy to be partnering with the U.S. Census Bureau in taking the tools and lessons from the Opportunity Project and applying them to healthcare for the TOPx showcase. I know I wanted to cover just three things briefly, and then I'll turn it back. One is the importance of collaboration. The second, thinking a little bit about open industry standards and fire, and then third, the broader importance of all the work that you're doing today. So first off, public-private collaboration is really important to me and to ONC. I began my health IT career in Indianapolis, where I went out to help to look for opportunities where industry, academia, and government could, sort of get together and think about, where they can synergize, the work that they do to create higher value than any of those sectors could on their own. And that led to the formation of the Indiana Health Information Exchange, which many of you may know is one of the most successful HIEs in the country and still continues to be today. Spent 20 years in the private sector working on collaboration kind of things, all the way up to helping to lead the Argonaut project, which I was doing up until I started this job on January 20th, which the Argonaut project is a collaboration, a cross-sector collaboration of health IT vendors, provider organizations, health plans, and big tech vendors. They're typically consumer-facing type vendors like Microsoft and Apple, to help accelerate the use of open industry standards and open industry conventions of interoperability in healthcare. So collaboration is just tremendously important to me. And one of the things that I've became keenly aware of early on is that there are many, many ways that government can screw things up in the area of innovation, and I should just say that as a caution. But I also recognize and recognized early on that there are many, many ways in which the government can be an absolute accelerant and a terrific partner. And so that's why I think it's really, really important for us to be collaborating with the private sector to figure out all those ways, and to get your candid feedback on the ways that we can, really help to eliminate barriers, help to, sort of facilitate enablers, and not, screw things up, not stifle innovation, all at the same time. So with the National Coordinator's Office, we take very seriously the C in coordination, and that that's sort of reflected in the work that we do, helping to coordinate and working with our federal partners within HHS, like the FDA, like the Assistant Secretary of Health, but also across the agencies, like with the Census Bureau and other agencies. But also, and equally important, is coordinating with the private sector to try to, as I said, identify opportunities where we can help to remove barriers and help to further the industry and accomplishing greater value for developers, implementers, users at the end of the day, to get the highest possible value at the lowest possible cost. Second thing I'd like to just touch on briefly is FHIR. For those of you who are familiar with FHIR, Fast Healthcare Interoperability Resources, is getting widely and very quickly embraced by the industry as sort of the mechanism or the standard for interoperability for the future. One of the things that's really important, from an ONC perspective, we've been doing a lot of work, starting with innovation grants that go back to 2010, that led to the creation of the Smart on Fire program at Boston Children's Hospital. Sort of fast forward, and that got us to the place that FHIR has today in sort of the mind share of those thinking about interoperability and standards-based exchange in healthcare. But it's important not just as an open industry standard, and not just because it's more functional than its predecessors, and certainly more important, but it's more important because it opens up healthcare to more developers in particular. There's a huge base of FHIR resources now that are becoming available. And I encourage all of you in the industry and all of you, who are the showcase developers here, to the extent that if you haven't, to be thinking very hard about how you can facilitate interoperability with everything that you develop with that growing base of FHIR-based capabilities out in the market today. There's something like 80% by the most recent ONC surveys of electronic health records that are in place in hospitals and provider organizations across the country. Something like 80% have FHIR-based capabilities already available in those systems. And that's before any regulation requires them to have that. As many of you may know, ONC has regulations that actually requires FHIR-based capabilities according to a particular implementation guide to be made available in those systems for patient-facing as well as other types of use cases from those electronic health record systems. So I would encourage all of you to think really hard about that, because that is a base of capability, of a foundation that we spent a lot of time and a lot of money spending, and we really look forward to having all the applications that you build being able to leverage and add greater value to the capabilities that are already in place today. The second thing that's really important about FHIR, as I just sort of briefly touched on, is that, and to me this is more important than the functional capabilities of the standard itself, is that FHIR opens up the world to developers outside of healthcare, like many of you who are represented in the showcase today. It helps us to tap into people in that true crowdsourcing sense that Kristen mentioned, and that all of us I think have learned from the internet, and the power of that, and it helps us tap into people whose very first instinct is to think in terms of cloud native applications and scalability and high reliability and B2B and B2C models and mobile devices and open industry standards and open source tools and components and platform business and technical models and on and on and on. All of those things aren't things that come instinctually to the healthcare world. So all of you coming in, having already embraced that from in other sectors of the economy, coming in and bringing all of that instinct and all of that insight into healthcare is just hugely important. And we want to do everything we can from an ONC and federal government perspective to welcome you and embrace you and have you sort of apply all of your talents and all of your lessons learned to the very important problems that we have in healthcare today. Last thing I just want to touch on is that as important as the work that you're doing, and I know Sara and Kristen talked about sort of the drivers of the urgency to be able to sort of leverage what the TOPx program could harness to be able to get a group of developers like all of you to be able to help solve immediate problems for the pandemic. I just want to make sure that all of you know that that everything that you're doing has tremendous value beyond this, and long-term and enduring value. We've seen that the industry was already moving toward location-independent care in all of its various sort of modes that one could think of. But the pandemic, I think all of us saw, vaulted that move to seeing what the opportunities are and what some of the challenges are, but importantly what the opportunities are, and how much of sort of the patient population and users would actually embrace it in many ways. So when we think about the types of remote diagnostics capabilities that are going to be demonstrated here and that all of you are working on, I think we're looking at that as part of an important telehealth ecosystem that includes not just everything that you're doing in terms of remote diagnostics, store forward, asynchronous kind of capabilities, but is sort of a part of the puzzle that sort of matches up with synchronous video and audio communications, remote device monitoring in more of a streaming mode, and mobile apps for care team collaboration and patient engagement. So everything that you're doing today, and I think is going to be showcased today, are important functional capabilities that are going to be a part of the way we think about healthcare going forward. So I really look forward to everything that you're going to be able to showcase today, and hope that you'll continue the energy in thinking about how we can move healthcare to more modern ways of bringing healthcare to people wherever they are. So thank you very much. I don't want to take any more time. I know all of you are here to see the showcase, as am I, and I just I really look forward to everything that all of you are going to be showing today. So thank you very much.
Thank you so much, Micky. So grateful for you that you're able to join us today, and thank you so much for your leadership on this effort. We're excited to have had you speak, and now I am so thrilled to introduce Dr. Ron Jarmin, Acting Director of the U.S. Census Bureau. Since January 2019, Ron has also served as the Deputy Director and Chief Operating Officer, leading execution of the 2020 census. He performed the non-exclusive functions and duties of the Director from July 2017 to January 2019, and previously served as the Associate Director for Economic Programs, leading the 2017 economic census, overseeing a move to 100% internet data collection. Since beginning his career at the Census Bureau in 1992, he has served in many leadership positions and has been a champion of innovation and technological advancement. So we're very excited to welcome him today, and over to you, Ron.
Thanks, Drew, and good afternoon, everybody. And Micky, I'm really glad to see you in the hoodie. I was in a meeting downtown today, first time I've been in the Commerce Building since last March. And I was wearing a suit, and I came home and I took the suit off, but I left the shirt on, and I have shorts and Birkenstocks on. So I almost got to the hoodie, but I thought I'd leave the shirt on for this. But so anyway, it's great to be here today, and really excited to be co-hosting this along with Department of Health and Human Services, especially given all that we've experienced over the last year, which hasn't been easy for all of us. And you know, since the arrival of the pandemic at Census, we really tried to make sure that the safety of our staff and the public was a priority, especially during the conduct of the 2020 census. And we're really thankful for our nation's health professionals and all the amazing work that they've done to promote health and safety over the past year plus. And so, like I said, carrying out our mission from the 2020 census to our many national surveys of both businesses and households, we've aimed to protect the health and safety of those we serve and those that we employ. So today, during this event, you're going to learn a lot about sort of firsthand see 12 digital projects that are addressed to look at exactly these sorts of challenges with COVID-19 data collection and reporting efforts. So over the past few years, our team at Census has honed this great model of collaboration between government, industry, and community stakeholders to create data-driven tools that serve the public. So it's no surprise to us that HHS wanted to apply this model to help catalyze tools that help key stakeholders manage COVID-19 testing data to support local and national response efforts. So we're thrilled to be working with them, and this collaboration between Census and HHS, virtual tech development sprint that resulted in all the great work that you're going to see today. It's just a great example of how I think the Census Bureau has been leading the way in government data innovation. So at Census, just as innovating how we collect and disseminate our data is important, we also highly value the transparency and engaging the public with our data. Both these values are reflected in how the TOPx COVID-19 Sprint program was run, with extreme transparency, progress shared in real time, and the opportunity for any member of the public to participate. It's also exciting to see that HHS has adopted the Bureau's tech sprint model, the opportunity projects, or TOPx, and used it for data collection. As you'll see in today's demos and lightning talks, many of the teams are sharing data securely with HHS as a result of this sprint. At the Census Bureau, we are continuously investing in creative work around the future of data collection that promotes privacy, trust, security, accuracy, and timeliness. This is just as important for COVID-19 data as it is for the data we collect here at the Census Bureau. 2020 was a year that tested our patience, our faith, our strength, but despite all that, the extraordinary circumstances that we were all experiencing around the world, we succeeded through tenacity and the creativity of the women and men who work at the Census Bureau. Simply maintaining operations would have been considered a win during these trying times, but in light of all of that and making sure that we are keeping the health and safety of our communities and employees safe, the Census Bureau was able to push forward and come up with some great innovations. So recognizing that there was a lot of value that we could provide in putting out timely data on the pandemic, we developed 2 new pulse surveys designed to help us understand the impact of COVID on households and businesses across America. So these 2 innovative surveys, the Household Pulse Survey and the Small Business Pulse Survey, provide data on the ways that the pandemic has impacted households and small businesses over the past year, including changes in how we, the questions that we ask. So these 2 new surveys launched in the middle of the pandemic was just an amazing accomplishment that came through not only our hard work, but collaboration with other government agencies and especially with the Office of Management and Budget. So the Household Pulse Survey captures information from households on employment status, consumer spending, food security, housing, education disruptions, and dimensions on health, including recently people's willingness to get the vaccine. And the Small Business Pulse Survey captured information from businesses, with fewer than 500 employees on location closings, changes in employment, disruptions in supply chain, and use of federal assistance programs, and also expectations about future operations. They both proved invaluable to policymakers and the public more generally. We also created a new interactive data hub at covid19.census.gov. This built on successful work helping communities get information and recovery from severe weather events. So we launched this last April to give communities one-stop shop for helpful information about their communities from the Census Bureau. And the hub was recognized by FEMA at some point last year as their COVID-19 site of the week. So the creative, adaptable, and nimble mindset that helps us succeed in these efforts is the same that underpins TOPx, and we are without a doubt very proud of the amazing work that TOPx has done and the agency more generally. So before I wrap up, I just want to remind you, hope that you'll stay with us for the remainder of the event. There's going to be lightning talks and live demos from the technologists who developed some really fascinating and cool products. Today's event will also host conversations with leading experts from government and industry to facilitate learning about the vast responses to the COVID-19 pandemic. So thank you to the hundreds of stakeholders who participated in this sprint, and to our colleagues at HHS for partnering with us on this effort. And everybody, I hope you have a great and thoughtful and productive afternoon. So have a great day. Thank you.
Thank you very much, Ron, and thank you for your ongoing support and for pushing our team and the Census Bureau to continue innovating on how we collect and share data. My name is Anna Valuev, and I'm Head of Strategic Initiatives with the Opportunity Project team. As COVID-19 diagnostics testing expands to homes, places of work, universities, airports, and other unconventional locations, federal, state, and local public health authorities need tools that ensure data is collected, reported, and analyzed in secure and interoperable formats. Such information is critical to guide the national response and allocate resources, conduct contact tracing, mitigate the spread of COVID-19, and make data-driven decisions based on an understanding of disease rates in local communities and populations. A number of tech teams develop digital solutions to address just this challenge. So now, to introduce this important topic is Alan Fox, Head of Information Systems at Ellume Health, an FDA-approved at-home COVID-19 test manufacturer that has collaborated with at least one tech team in the sprint to ensure that data collected through the tests are consolidated and shared with local and federal health authorities, as well as schools, employers, and other key stakeholders. After hearing from Alan, we'll turn it over to 2 of the tech teams who address this challenge. Over to you, Alan.
Hi, my name is Alan Fox, and I'm Head of Information Systems here at Ellume. Today, I'm going to talk to you about at-home diagnostics. Now, before I get started, I'd like to ask you to think about the last time that you or one of your friends or family was tested for COVID-19?
It may have involved wait times to get a prescription or referral for a test from a medical practitioner, waiting in line at a collection centre to have someone clothed head to toe in personal protective equipment insert a swab up your nose all the way to the back of your throat, or hours or days of isolation at home awaiting your result. Now, reducing the time from symptom onset to test result becomes even more important as therapies become available, and a quick diagnosis, followed by quick treatment, is important to not only stop the spread of disease, but to facilitate a good health outcome for the patient and return to daily life. The processes I have just described are all due to good people doing the best they can with the tools and systems that they have. The problem is that the centralized testing systems we have, which are fantastic for high-performance testing in normal circumstances, cannot cope with the burden of testing in a pandemic. They were not designed or set up for that. And so I am here today to talk to you about Ellume and our first authorized at-home COVID-19 home test and its connectivity. Dr. Shawn Parsons founded Ellume after working in an emergency room during the swine flu pandemic in 2009 and noticing a real need to diagnose patients outside of emergency care settings where there are other sick and infectious people and, importantly, quickly so that they can receive the appropriate treatments to get better soon and reduce the spread. He set out to create an at-home influenza test and along the way created a sensitive diagnostic platform that can be easily adapted for other pathogens that is easy enough for someone to purchase from a pharmacy, take home and do themselves. Ellume applied that technology to create the Ellume COVID-19 home test that last December received the first FDA emergency use authorization for a non-prescription at-home rapid COVID-19 antigen test. The Ellume COVID-19 home test consists of 4 components: an analyzer, a unique nasal swab for increased comfort, a dropper, and processing solution. Once you have a kit, you connect the analyzer to your Android or iOS phone via Bluetooth and follow the video and animated instructions to perform the swabbing and sample preparation steps. Once you have added the sample to the analyzer, it takes 15 minutes for it to generate a result, all within the analyzer. It then transmits the result to your phone for display. The Ellume test's uniquely digitally connected nature means that it can automatically share any information a user has chosen to with an optional telehealth visit to get approved COVID-19 treatments quickly. That's in development. Organizations such as employers or event organizers to facilitate daily life activities, and federal and state health authorities via the Waters Project and our partners at Lifepoint, who you'll hear from soon. This mandatory result reporting to health authorities helps ensure that clinics, hospitals, schools, businesses, and families have the information and resources necessary at the right time to reduce transmission and treat the ill without the user having to manually report results. So not only does the patient know straight away, but so can the employers, event organizers, and pandemic response managers that can start to react days earlier to emerging hotspots and prevent outbreaks before they are out of control. I've briefly touched on Ellume, our rapid COVID-19 home test, and how connected at-home testing can lead to better health outcomes. Thank you for your time, and I look forward to discussing how the Ellume COVID-19 home test can help your situation in the live product demo exhibit later today.
Now we're excited to move into lightning talks from two of the teams who focused on the challenge of enabling state and local governments to track the spread of COVID-19 in their communities. First, I'll hand it over to Ross from Lifepoint to kick it off. Over to you, Ross.
Great, thank you, Anna. So I'm going to get started here by just providing a little bit about Lifepoint and then going a little bit more into detail on our reporting hub. So we have been in business for over 20 years, and we focus on the ability to integrate with clinical laboratories, both hospital and commercial laboratories, and connecting them to physician practices. So we have over 10,000 practice connections, and we process billions of transactions annually. Below are just a sampling of some of the clients that we've worked with in the past. Now, as a response to COVID, we've added several features to our core focus to meet the demands of the COVID pandemic. So a few of those are our patient access portal, which has been providing patients instant access to the results, and we notify them of positive or negative results. And we also have this available on iOS and Android. We also have a provider portal, which provides secure access to providers to get their results for their patients. And then also in a employer-based portal, which helps employers get their employees back to work. And then lastly, which we'll talk a little bit more about today, is our reporting hub, where we report public health data to each jurisdiction. And we've processed well over 10 million results to those states and waters as well. So before I get into our solution, wanted to mention some of the issues that we've seen along the way. So we recognize that that COVID pandemic, as well as the integration to these public health departments, was lacking certain key identifiers that are required not only by the CARES Act, but by these public health organizations to be able to receive the data and provide contact tracing more accurately. And this really comes into play with rapid tests and point of care testing. So testing that you're performing at your house or at a urgent care center. We also found that there were resource constraints, both at the laboratories and at the state levels, as well as the point of care and rapid test manufacturers. It just wasn't something that they were equipped to do and had the experience with. So here's just a quick diagram that illustrates how we do what we do. And this is an example for both laboratory and point of care or over-the-counter based tests. And essentially what we do is we build an interface or a connection, meaning we take information from a lab information system or a instrument manufacturer, and with some of our partners, they have a mobile application where they're collecting patient information, and we build that connection to those systems. We consolidate or normalize or harmonize that data within our hub, and then from there, we're able then to pass that data downstream to each of the state health organizations and then to federal organizations as well, ensuring that we're getting the most accurate, the most up-to-date, as well as the best data we can to those state health organizations. And here's just a quick progression of the process. So the first step is the patient registers in one of these applications. The next step is that they collect the information, collect the sample rather. So most of the time it's a nasal swab, and then they're squeezing some of the solution onto the test cartridge. And then the test is actually read on those devices. And here's where we then get the data to our Lifepoint hub. And then from there, then we're transmitting that information downstream to public health organizations as well as Waters, which is the HHS connection. So thank you. And if you need more information, you can always reach out to us at sales@lifepoint.com. Thank you. And back to you, Anna.
Thank you, Ross. It's great to see how you utilized your existing technology to address this incredibly complex and important challenge and worked with so many stakeholders from state and local jurisdictions to get them the data that they need. Next, we'll turn it over to Raphael from Net Medical.
Thanks, Anna. Hi, my name is Raphael M. Rubio, and I'm the president here at Net Medical Xpress Solutions. And I would like to tell you a story about our platform, Telemed, and COVID-19. I joined Net Medical in 1999, right before the IPO. We were a .com company, if you can imagine that. In that time, we've built a lot of telemedicine solutions, including solutions for mobile radiology, for long-term care facilities, and cardiology and stroke consultations. And you know, we've been through the 510K process for software development. We've served millions of patients, and not once did we ever think we'd be reading a paper about an unidentified pneumonia outbreak on a cruise ship, you know, thinking what was going to happen to the world. In our story, the first effects of COVID-19 that we saw a precipitous drop in the number of stroke consultations that we were handling because the lockdowns either kept people at home because they were scared to go out or because they didn't have access to care at that time. And it occurred to us that our work with the long-term care facilities for tuberculosis screening was extremely relevant, right? We had done the data collection and the imaging and the orders and the diagnostics, and we were doing all of that remotely already. So in 2020, we added COVID-19 lab or test management, I should say, and data management to our platform, because we believe that it is a telemedicine problem at its heart. So if you fast forward to the end of 2020, I'm sitting on a town hall FDA call, listening to Tim and Toby talk to test developers. And I feel like I know them pretty well now after the number of weeks of attendance. But anyway, they mentioned this COVID-19 at Anywhere Diagnostics Design-a-thon competition. And we realized that our platform could be extended with a Bluetooth API to provide the capability of sending in wireless test results on an open standard. And we learned about the Waters database, and we learned about, you know, the at-home testing requirements for getting you know, lab data at home and into the Waters database. And that was our submission, you know, was kind of Telemed with, you know, an API addition to it, and it did pretty well for us. We got a bronze prize in that competition. But that led us to this, you know, the TOPx project, and we started looking at demographic data collection. And we want to understand what data is really useful now, you know, going forward beyond just whether you were positive or negative. And we looked at equity of response data as a broad category, and employer requirements and breakthrough test requirements. And we realized that flexibility in the platform was going to be key. And that's what we ended up doing, right? We ended up adding the ability to add new data fields quickly and add new imaging pathways for selfies and test results and barcodes over MMS and all kinds of technical stuff. But it led to a lot of what we believe are good customer wins here, right? So if you need to do non-standard demographic data collection like the state of California, we've got an answer for that. And if you need to act on strict reporting requirements like the 4-hour employer requirement in New Mexico, you know, we have something for that. And the public can even report on our platform if they wanted to, their at-home tests, and get it up, you know, to the Waters database and use it for verification if they needed to. So you know, our story has led us to having our platform extend into the COVID-19 space and helping us. For us, we use it as a mobile lab, right? We use it for testing employers and groups as a mobile lab, but we could use it for much more than that now. We've added all these features, and we want to be a trusted third party that's already a medical company to help people solve their COVID-19 data management solutions. And we think we've made something that's really useful to the public. So with that, I just like to say thanks to everyone at HHS and Census for including us in this, and we hope to see everybody in the product workshops, and I'll turn it back to you.
Thank you very much, Raphael. It's incredible to see how you adapted your technology to address the COVID-19 pandemic by incorporating so much data and enabling a great deal of flexibility. And thank you to everyone who contributed to these products, as well as IBM and Oracle, who also developed solutions to this challenge. IBM's Digital Health Pass enables businesses to verify health credentials for employers, customers, fans, and travelers entering their site based on their own criteria. Oracle's COVID-19 immutable test results submission and visualization tool allows for real-time reporting of individual and batched results in a trackable manner with confidentiality, integrity of identity, and immutability of data. You'll have the chance to connect with both of them during live demos from 2 to 3 today, so be sure to stay on for that session. And now we'll turn our attention to the second problem statement that tech teams addressed during this sprint: empowering operational decision-making. Stakeholders conducting large-scale testing, working in collaboration with state and local health authorities, also need to send COVID-19 data to key community and business leaders to make decisions. School boards, large employers, and other organizations utilize information on COVID-19 infection rates to make recommendations for immediate or future action. For instance, a school board making a decision about reopening a school or managing an outbreak in their district must have an accurate understanding of infection rates and trends in the local community, as well as the capacity to manage future testing upon reopening. So now, to introduce one such context in which COVID-19 testing data is pivotal to critical operational decision-making, I'm thrilled to introduce Shawn Laughlin. Shawn is a police commander of the Detention Division at Broomfield Police Department in Colorado. He also played a key role in the TOPx COVID-19 sprint by generously offering his feedback to tech teams working on this challenge and connecting them to share the unique needs and challenges of the correctional industry. Over to you, Shawn.
Thank you, Anna. I really appreciate the introduction there. Also related to my role as Second Vice President for the American Jail Association, which is what really started this relationship with TOPx, as well as selfishly my own facility. So I'm going to spend a few minutes speaking about some of the challenges that we were faced with COVID, as well as some of the solutions and how we are able to greatly accelerate our solutions as a result of our involvement with the TOPx program, personally and then professionally. As you are well aware, when COVID hit about 15 months ago, correctional facilities were caught off guard like the rest of the world was. And we quickly learned that we had to come up with better solutions than what we were currently doing. Just to give you a little background information that most people don't know, about 90 to 95% of the jail population across this country, they're not going to go to prison. They're going to return back to the community. So we quickly realized that we had an obligation to not only prevent outbreaks inside the facility, but we also had to ensure that we didn't return infected inmates back out into the community without them knowing what their status was. That was very important to us. Additionally, with respect to technology, most jails do not allow cell phones. So many of the private sector solutions that I would call sort of a pre-canned solution that you could adopt a platform weren't going to work in a jail because of the absence of the cell phones. However, that being said, through the time spent with the TOPx folks and the different companies that have participated, we were able to draw in many of the technological solutions and the programs and policies into the operations of the jail, and have seen just very, very impressive solutions that we, quite frankly, otherwise would not have figured out on our own. As you know, the technology curve relative to the private sector versus the public sector is pretty substantial, but this unequivocally has flattened out that curve quite a bit. So a few things that came to light right off the bat with COVID. First and foremost, we had a cohort, right? CDC offered phenomenal guidelines to jails and congregate housing facilities. So we learned right off the bat that this was going to be a pinch point for the entire criminal justice system. And in fact, it truly was. Jails have pretty good capacity, but what they don't have is a lot of capacity to cohort house inmates for 10 to 14 days. So that in turn backed up the entire criminal justice system: probation, parole, courtrooms, the ability to move prisoners between facilities, inmate programming, mental health treatment. All these core functional capacities that a jail almost ended overnight across the country, greatly affecting about 25 to 3,000 jails across the country. as some of the other guests have pointed out, our involvement with TOPx began the late fall, early this year, so about 5 or 6 months ago, and we were able to start to integrate our problem with those solutions. It's really that crossroads of the technological solutions with our operational decisions that we needed to make that really started to speed up the process for us to get the criminal justice system reopened. We're still not there yet, but with respect to the care and custody of the inmates and the operational decisions that we needed to make relative to our day-to-day operations, this was a big game changer for us. So I'll just cover a few of the points in my limited time here. The first thing I want to bring up is digital passports. So digital passports, that whole concept, and many of these companies have perfected this, operationally was a game changer for our facility as well as other jails that we've since introduced this to. Now, like I said earlier, you don't get a cell phone inside a jail. Even staff aren't allowed to carry a cell phone. So the digital component of it won't work in a jail while people are incarcerated for the staff or the inmates. But what came out of those discussions in our meetings with the various vendors was the adaptation of the processes around the digital passport. So for jails, for example, every inmate has, in most jails, has an inmate ID card. So what came out of this was the ability to put a very modest color marking on an inmate ID card that serves as their digital passport while they're in the facility. And what that enables them to do is to move freely throughout the facility without the use of PPE equipment. It opened up mental health counseling again, it opened up group therapy sessions again, anger management, religious services, all the core programming components from operational decision that had been halted or greatly reduced for 6, 7, 8 months. We were able to reopen based on the knowledge that we knew an inmate had been vaccinated previously, and we had validated that, and we had integrated those operational decisions into their ID card. So something so simple as an ID card took the digital passport concept and brought it into the jail. Additionally, all jails utilize jail management software systems. So these systems track when inmates move, what housing pod they're in, separations from who they can and cannot be with, victim issues. So we quickly, again, adopting that same digital passport ideology, adopted and utilized it inside our jail management software by putting in separations and non-separations. So in a nutshell, along with the ID card that was created is a digital file that's attached to that. And that shows that as the inmate moves from facility to facility, that they have been vaccinated and they are free to function inside the facility without additional staff support or PPE equipment. Additionally, it also blocks transfers into housing areas of inmates that have not been vaccinated yet. So the old system would have been a roster to confirm, right, back and forth. But now with the passport, or our version of the passport, we are able to essentially break out the differences between vaccinated individuals and non-vaccinated individuals that were cohorted and continue and get our programming back up and running. So those two really big things. Another feature that we have adopted from the private sector side, and I thank you all very much for making my job a lot easier, was the simple vaccination card. We started vaccinating inmates about 6 weeks ago and in the various forms, and have wholeheartedly embraced vaccination about a week and a half ago for all the inmate population. And what this enables us to do is reopen our courts and transfer inmates to and from other jurisdictions where they have multiple charges pending. This is important to the victims that would like to see resolution of cases. It's important to the suspects who would like to see resolution of the cases. But what we've done for the card, with the card is we've ensured that the inmate walks away with the card, and then they can digitally scan their card onto their phone when they do get released from custody. And then on the back of the card is a statement from us letting the person, whoever views the card, know that this particular person was vaccinated by the city and county of Broomfield, not the police department, not the detention center. We're trying to avoid that stigma associated with that, but by the city and county of Broomfield. So it sort of creates that lowest common denominator that allows them to feel proud of the fact they got that vaccinated, as we're highly encouraging that, but not stigmatize the fact that they're incarcerated, which is where they got their vaccination card. I just want to briefly talk about the data tracking with respect to jails. When we first were encountering COVID about 15 months ago, for the most part, the CDC rules were very strong, but they really didn't touch on operational aspects of how to run a facility. So what a lot of jails were doing is they were waiting till 2 or 3 days after processing someone to do COVID testing. And then, of course, another 2 or 3 day delay. So by the time they got in your facility, it could have been 6 or 7 days before you realized that they were actually asymptomatic positive. So what came out of the TOPx testing process, and again, that private sector ideology, was the ability to move the point of care to the time of processing. And for most facilities, that was not a consideration. And what it did was essentially was a game changer with respect to the ability to know with immediate testing through Wi-Fi whether or not that person was presumptive positive through rapid test, and then follow up with a PCR within a couple of days. So that enabled us to greatly change our classification decisions and housing decisions on whether or not that person needed to be held in custody or needed to be diverted to a healthcare facility if they were showing symptoms. So that was another really neat feature that came out just randomly in just speaking with the various vendors and helping them develop their products for other sectors as well as ours. One last thing I want to talk about is just a level of engagement. This is the first such activity that I've been involved with, this public-private partnership. And it has been a wonderful outcome. As you know, the technology curve is pretty substantial in this particular industry. Having access to Anna and her team and CDC and Census and HHS and all of you wonderful private sector people who do this for a living has just been a game changer for the industry. And unequivocally, I think it sets a new benchmark for how we should relate with each other and how we can utilize our technology. It's nice to get a product to me that we've had some involvement with on the front end to ensure that it meets our needs rather than having to adapt to it later, which is usually the case. So I could go on and on about this. It's an amazing team. It's amazing setup and product lines that you guys have developed. It has really helped us get the criminal justice system back opened up again, which I think most people don't realize yet, but they will realize pretty quick here what amazing work you all have done and how much we're going to apply this moving forward as an industry. So from the bottom of my heart, I thank you all very much. I think that's all about out of time. So with that, I will turn it over to the tech teams, and thank you very much.
Now we'll hear lightning talks from two of the tech teams who developed tools to empower organizations in making operational decisions based on COVID-19 testing data. First, we'll turn it over to Allison from UDoTest.
How do you know when it's safe for all of us to go back to our offices? I'm Allison, the CEO and founder of UDoTest, an at-home disease testing software company. I founded UDoTest 8 years ago when I needed to go for my pap smear in South Africa. And what I quickly learned, however, is that cervical cancer was killing 15 women every day in my home country. Now that was unacceptable to me. So fast forward 8 years, a wild adventure, many awards and thousands of lives saved, UDoTest has won global awards. We now work with 15 plus national and regional labs across the country. We offer upwards of 78 diseases that can be self-collected in the home, including chronic disease, metabolic, cancers, flu, etc. And our most recent HHS award has dove us directly into the COVID OTC testing world. Our most exciting news is our work and our integration with Recuro Health as of this spring. Some of the clients that we serve and are proud to serve today with a customized at-home testing solution for them are folks that you can see on your screen right now. And through the TOPx program, we've been extremely fortunate in working with even more user cases. So those include folks from your companies, your large companies who have upwards of 50,000 employees in some cases, to folks in hospitality, as well as travel and leisure partners. What these folks found really helpful about our solution is that we can help them with their own reopening strategies. And the flexibility of our system is also really important to them because they can do either weekly testing or on-demand testing, both in the US as well as outside of the US. They really appreciate the opportunity to instill confidence in and amongst their customers who want to come back and use their facilities, but also safety amongst their employees and enabling them to feel safer. It instills this confidence. It is a secure infrastructure, and our live dashboard gives them the tools and capabilities to safely make rational decisions. And a quick example of how our user journey might be experienced when an employer works with us is they get a hold of the test, they issue the test to their employees, and they register various portals on our platform. From there, the information is captured and verified to ensure that it is a valid test, and various consents get captured at this point. The patient then completes the test. There is a wireless transmission of information that goes from the test itself back to our system. And last but not least, our system then reports the results to the patient, the employer, and the state and federal government repositories at that point. An example of what our employers can experience in a customized dashboard of tools that help them to make rational decisions include information on the test, the lab, the physician, who to contact, the results, etc. And our service is absolutely live and is helping many clients today, but we focus on your large to mid-market employers, your carriers, your telehealth providers, can service your government agencies, have served schools, and absolutely have a focus of more broader integrated care, which is what our passion is, because we do not need to be in this situation again anytime soon. So if you are a payer or a provider or an employer looking for a solution to reopen your workplace and to support your employees and your customers, contact us. I'm Allison, the CEO of UDoTest, partners@udotest.com. Thank you.
Thank you so much, Allison, for sharing your personal story of UDoTest's inception and the diverse ways in which your product can be used to promote safety. Now over to Linda from DLC Enterprises.
Hi, I'm Linda Carr. I am DLC Enterprises, and I want to share with you one of our solutions called CoVerify. It is our reporting solution that we've developed. So when CoVerify first came about, it was basically designed from a solution that we had put together in 2018. Then, of course, COVID happened and everybody got sent home. And it had originally been planned to be research. We had planned on the application to be for reporting and such. But then we found out that we had the ability to make use of this data and not only use it for research, but also be able to add to it so that people could actually get their results more quickly, so that employers could get their results quickly, and so that we could send data over as needed to agencies, to the states and the counties and those types of things. And then even further on, as we worked more and more, especially with the TOPx and the HHS folks, we found that we could also add things such as the vaccine passports and the ability to do some other things, which I'll share with you here. So what I wanted to do is kind of show you very quickly, within our CoVerify application, you'll notice that we have the ability, we have 3 different areas that we cover. I'm going to briefly kind of go over what happens with a particular patient. If they happen to feel sick, they would log into our portal. And when they log in, they would click on the patient, the little patient circle that you see there at the bottom of the screen. They would register if they hadn't already. They would then log on, select which one of the clinics that they wanted to get their test from. They would then schedule it. It would then send them an email, as well as if they hadn't previously scheduled, it would send them a QR code so that they could then share that QR code when they went in to get their test. They would then get their test, all right? Or in this case, you know, this particular person happened to getting a vaccine as well. So after that information, after they had done that, then they would immediately get, within 15 minutes or however long it takes for the lab to send the data either wirelessly, or if they are directly connected to us via, some of our customers have directly connected right in with us so that they schedule their patients, give their patients their tests, and then literally within minutes, the user has the information, it goes to their phone app, and then they also it goes to CDC or the state or wherever it might need to go. If it's a lab only, the lab would have a whole list of people, they can schedule them, They can actually get their tests, upload them again. You know, it doesn't have to be the patient that's initiating this information. It can be almost, it can be either the lab or the patient or even an employer. One of the things that we've done with Co-Verify, we've worked with a number of states and counties and schools even to be able to provide them with a way to get all their people back to work. And that seems to be the biggest thing that we want to do nowadays. The other thing we've done is we have some future plans. DLC is working to try to not only provide what we need today, but to make sure that we're ready for tomorrow. Okay, so one of the things we've done is we've developed a little QR code that has, we have one not only for the vaccines, but we also have one coming out shortly for STDs. And one other thing, and we just saw this happen today, actually just a little while ago today, with someone had whited out someone else's name on a card, and their employer said, wait a minute, this doesn't look right. They actually contacted us, and we were able to provide them via something that we've already built into our environment, the ability to send directly, provided that the customer allows it, directly to an employer a copy of their vaccine card or their health card. So first of all, we really appreciate the opportunity that we've had with HHS and Census to do all of this. And we're hoping, and if someone needs something, we're looking forward to working with you on the 25th so that we can go through and show you even more. Thanks again. And if you need anything, please don't hesitate to reach out to us. We're very happy to talk with you. You'll see my phone number and emails are both here. Thanks very much.
Thank you, Linda. It's amazing to see how quickly you were able to found and launch this company and create solutions for patients, laboratories, and employers. We look forward to seeing how all of these products will continue to grow and scale to use cases beyond COVID-19. And thank you to everyone who contributed to these products, as well as to Interpret COVID and Doval Technologies, which also developed solutions to this challenge. Interpret COVID's consumer diagnostic test app records, monitors, and reports rapid consumer COVID-19 diagnostic test information for both individuals and groups to reopen society safely. Doval Technologies' Patient Health Ecosystem Portal allows clinicians to share health information with patients, health institutions, and providers. Both teams will be presenting at live demos from 2 to 3 today, so be sure to stop by their virtual booths. Now we'll turn it over to our last problem statement, helping consumers and businesses manage testing data. As COVID-19 test and vaccination data becomes more readily and quickly available, there is an increasing need for digital tools that serve organizations conducting the testing, providers involved in the care of patients tested at such facilities, and consumers seeking to record and prove their test results or vaccination status for activities such as travel, and even the business owners and travel organizations who will become frequent consumers of this testing data. So now, to provide us with some context on this challenge and the importance of being patient-centric in our technology solutions is J.R. Denson, Health Policy Advisor and Advocate for the Asthma and Allergy Foundation. J.R. played an instrumental role in the sprint by offering the tech teams patient-centered feedback on their products, and we look forward to hearing from him. Over to you, J.R.
Thank you very much, Anna. So hello, everyone. Good morning, good afternoon, good evening, depending on when and where you're watching. Again, my name is J.R. Denson, and I'm a program manager and a patient advocate with the Asthma and Allergy Foundation of America. So far today, we've heard from several different groups about all these different innovative products that they have made to help with the testing and verifying of COVID testing results, and so on and so forth with related issues. And I want to make sure that we focus on the number one thing that's most important with this issue, and that is the patients. Because without the patients, the reason for this innovation isn't what it is, and isn't what we would see today. So as this project has gone on since this entire winter, I've been continually impressed by the thoughtful and intentional way that these teams have been working to bridge the digital divide and make these products convenient, accessible, and secure for the folks that are going to use them. You know, for any of us who have parents, friends, acquaintances that aren't super tech savvy and need some extra help from us or someone in their circle of influence, we want to make sure that that device, that product is able to be accessed by that person. We want to access our information. And on the other side, we want to make sure that our information is not accessible to folks that we don't want to have our information, whether it be in some cases our employer or in other cases, scammers engaged in identity theft or trying to engage in identity theft. Every few months, you know, we hear a story in the news about some big box store or a pipeline that's had its data compromised. And every time we hear that story, we wonder, how safe is my personal data? And as someone who speaks with patients every single day, and probably like many of you is a patient sometimes myself, I want to be sure that the tools and the resources that we use to maintain and keep our health are serious about the Hippocratic oath to do no harm, just as serious about that oath as the doctors and nurses and other healthcare professionals that take that oath. And so I, over these past few months, have really appreciated the opportunity to advise these groups on the practical usability and the security of protecting our health information and the process, the development process that these teams have gone through. So with that, we'll go ahead and turn it back over to those teams. Thanks.
And now we'll be hearing from the tech teams that built products to address this challenge. So we'll turn it over to those two tech teams. Really looking forward to it.
Now we're looking forward to hearing from two of the tech teams who developed solutions to address the challenge of helping consumers and businesses manage testing data. First, we'll hear from Ajintha at ClinIQ.
Hi, everyone. We're from ClinIQ Health, One World, One Health. Our focus is on border biosecurity and biosafety. My name's Dr. Ajintha Pathmanathan, and I'm the founder and CEO. As we know, 9/11 and COVID has changed travel and tourism forever. The past year has seen a dramatic decline in passengers and tourists to many locations. We're starting to see a recovery now with active testing and vaccination, and also health credential solutions coming to the market. We anticipate return to full recovery in about 2024, still a number of years ahead, and we also need to anticipate future disease threats and put solutions in place to prevent them. As we know, it's been a confusing world. Different countries have different eligibility requirements for travel, different proof for health credentials. There's fake COVID tests crossing the borders. Toronto recently fined a traveller $9,000 for a fake test result. The aviation industry is calling for health credentials to be backed by the administration. There's operational inefficiencies caused at airports and other locations due to the extensive checks. And now the travel and tourism market has had to dive headlong into the health market. They have to provide healthcare solutions, which is adjacent, which is not something that they're used to. So we're here to simplify the process and bring about a global interoperable solution. One world, one health, and one pass. Our solution's quite simple. We'll have one global map with testing, verified testing clinics and laboratories, and also vaccine sites from around the world. One platform where you can purchase your verified tests, and you can follow through with getting your results. Our One Travel Pass system means that we integrate to a number of travel pass solutions. We have a strategic partnership with IATA, the International Air Transport Association, with its 270 member airlines. We also provide for at-home tests on our platform and provide support through telemedicine. So you can purchase your test when you go to travel, and you can have your doctor at your global location assist you with the results and sample collection. We have a number of partnerships. We're now in 8 countries with over 450 clinics and laboratories coming on board. We've just commenced 2 airline trials this month with international carriers, and we have 3 airlines about to start. We're working with a number of universities around the world for staffing and intern placements. And we've also partnered with the 3 cloud providers, Google, AWS, and Microsoft. We're a global platform, but we work with local communities. We're working with universities, as I mentioned, to recruit a diverse, multilingual and multicultural intern and staff base. We want our teams to reflect the patients we serve. So let's travel again. It's safer with ClinIQ. You can contact us through our email at clients@cliniq.health, or simply go to our website, https://cliniq.health. Thank you.
Thank you so much, Ajintha. It's fascinating to hear about how your product will help consumers and businesses turn to the new normal surrounding travel. Next, we'll turn it over to Ken from Safe Health.
Thank you very much. I'm Ken Mayer from Safe Health. We're a partnership with Mayo Clinic. They have about 35% of the business and are very actively involved. We've developed an integrated digital health and connected diagnostics platform that enables rapid implementation of custom digital health applications that can be quickly set up, configured, even white labeled to service the specific needs of different populations or use cases. I'm going to take you through Health Check, which is a solution we built for employers and educators for managing ongoing COVID-19 testing and vaccine status verification. The system was developed so that employers and educators can have the freedom to allow their constituents to either be tested or vaccinated. We are tied in with the electronic health record systems, state vaccination registries, EHRs, Apple Health Kit, and Common Health, so that we can electronically verify vaccination records of employees or students. We also have developed an integrated rapid test system that enables employees or students to do their testing at home. This allows educators or employers to allow their users to scan tests. I'm going to walk you quickly through the workflow. There's a self-assessment, which allows the end user to report any symptoms they may have. They then get walked through a step-by-step collection process. There's a timer, and then when the test is processed, they can scan it with their phone, and the results are automatically returned utilizing an AI-driven computer vision algorithm. The results are then presented to the end user. If the test is positive, there's a built-in telehealth triage system where a licensed provider can have either a synchronous or asynchronous consultation to action next steps. And then ultimately it updates a visual passport that's also tied in with a credential system. And you can see there the QR code, which abstracts the person's personal health information, but allows the educator or employer to actually utilize that information to grant access or deny access. There's a robust admin console that provides advanced data visualization and all of the tools to manage the entire system. There's a lot of configuration features for things like type and frequency of testing, adherence reminders, so on and so forth. We've enabled a number of tests from leading developers on the platform. Q Health is a rapid molecular test that was approved for over-the-counter use. It gives you results in about 20 minutes with a simple nasal swab collection process. Again, it's authorized for use without a prescription, and there's no special training or certifications required. It's tightly integrated with the Health Check platform so that the results flow through to the verified status access control passport. Another test and partner is Quidel. It's a rapid antigen test. The results are returned in about 20 minutes, and it can be scanned using the smartphone RDT reader system, and again, used to update the passport status. This test is low cost and available in high volumes now. Again, we're a partnership with Mayo Clinic. They cooperate Health Check with us, and a lot of the protocols that are used within the system that are offered by default can ultimately be changed by the end user admin, were developed by Mayo Clinic. So that's our presentation for today. If you have any questions, please feel free to contact me at ken@safehealth.me or visit us at safe.health. Thank you very much and have a nice day.
Thank you, Ken. It's amazing to see how your partnership with test developers and the Mayo Clinic have resulted in a product that is usable by such a wide array of stakeholders. We're thrilled to see that all of the tech teams in this sprint have worked to collaborate with so many different organizations. We would also like to thank Oraliva and CuraPatient for their work on this challenge. Oraliva's smart clinical testing ecosystem for COVID-19 allows federally qualified health centers to integrate patient and COVID-19 test data as required by states and federal authorities. CuraPatient helps patients through their COVID-19 journeys from testing to vaccination to vaccine verification. You'll have the chance to connect with these teams and those who presented lightning talks during live demos from 2 to 3 p.m. today. And now I'll turn it over to Lorena Molina Irizarry, Director of Operations of the Census Open Innovation Labs. Over to you, Lorena.
Thank you, Anna, and hello, everyone. I'm excited to talk more about one of the most important components of TOP, which is open data. Throughout our sprints, one thing that all the more than 130 past tech products have in common is that they all use federal open data. In fact, they use and reuse of open data from the Census Bureau, HHS, and other sources is a core principle of TOP and TOPx. We believe that industry and communities together can build incredible solutions when given the chance to transform government open data into digital products. Over the years, we have enabled open data through tools like TOP Data Curation Hub and by connecting tech teams with data stewards from across government. What's exciting about the TOPx COVID-19 sprint is that it focuses not just on data use, but also data collection. Teams in this sprint, including some of those you've just heard from, are also securely reporting and anonymized data to HHS via a platform called Waters. It's a critical resource that enables the data flowing through the tools you're hearing about today to be harmonized and shared with federal and state authorities, helping policymakers use these data for the national COVID-19 response. And to shed some light on how this works, I'm excited to introduce Joe Meree from DataRobot, whom we work with closely throughout the sprint, and he'll tell us more about the Waters platform. Joe, over to you.
Hello, my name is Joe Meree, and today I'll be sharing non-lab COVID-19 test reporting with Waters and ReportStream. I'm an AI architect and I work for DataRobot. Why is test reporting so important? Reporting of diagnostic testing is critical in many ways. It provides visibility into emerging hotspots and variant formation. It informs decisions about prioritizing vaccine distribution or where to distribute testing or PPE resources. It enables contact tracing and many other benefits. Initially, most testing was lab-based and was reported consistently through state ELRs. There was no easy way to report non-lab and at-home tests. In addition, because non-lab tests are performed in places like schools and homes, results are not captured and reported consistently. This reduces federal and state visibility into the state of the pandemic. The use of non-lab tests is expected to rise dramatically in coming months. Our solution to non-lab reporting is Waters. Waters was built by DataRobot and Oracle for HHS. Its focus is to receive COVID-19 tests from test manufacturers and report to HHS Protect, named in memory of Dr. Michael Waters. HHS Protect provides information on the current state of the American healthcare system. Patient data is de-identified for federal uses. CDC Report Stream, its focus has been on receiving a variety of diagnostic data, submission formats, and reporting to state, local, and federal agencies for contact tracing. So point of care and at-home tests are sent by applications to Waters. Waters then sends those tests to HHS Protect and sends a copy to CDC Report Stream, which then forwards those results to the state and local health authorities. Now let's see how COVID tests are reported to Waters and distributed to HHS Protect and to the states via Report Stream. Here's an example of a command to submit a COVID test in a CSV file. If this were a real test, it would be coded into an automated computer system. Waters returns back the data fields it received to the sender. Here we see a subset of those fields. The yellow fields are important for federal and state reporting. Notice the blue patient last name field has been hashed to de-identify patient information in federal systems.
Looking forward, it is highly unlikely that this is the last pandemic, and we must be prepared for the next one, which may be bigger than COVID-19. We should use this once-in-a-generation opportunity to build fast, accurate, reliable, and smart systems that will protect us against future pandemics.
Thank you for your time and attention.
Thank you, Joe, for that great introduction to Waters and to the whole team who worked on creating this platform. We'd also like to acknowledge all the tech teams who are sharing data through this platform. Your willingness to collaborate is making a real difference in the fight against COVID-19. If you're tuning in today and would like to learn more about Waters and how to integrate your data products with the system, please visit waters.crowdicity.com and register to join the Waters community. And now we're thrilled to kick off a panel of industry and government leaders to share their perspectives about what's next for COVID-19 response and the products we just heard about, as well as the role of public transportation in public participation in solving national health challenges. Now I'll turn it over to our panel moderator, Dr. Sophia Liu, Open Innovation Director at the Department of Health and Human Services, who's on detail from the U.S. Geological Survey, where she serves as an innovation specialist. Sophia, over to you.
Thank you, Anna and Lorena. My name is Sophia. It has been exciting to help HHS lead the COVID-19 Diagnostics Design-a-thon and TOPx tech sprint and see how these solutions have evolved since we began this effort in November 2020. I'm honored to serve as the moderator for our panel today on future and looking to the future, where we'll discuss the value of these diagnostic data solutions and the role they will play in our response to the COVID-19 pandemic and other public health challenges in the future. We have two panelists today, Sara and Rajeev. Our first panelist is someone who provided the welcoming remarks and another one who organizes the tech sprint that we had, as well as the Design-a-thon. Dr. Sara Brenner is the diagnostic data lead supporting the U.S. National COVID-19 response operations at HHS. She also serves as an associate director for medical affairs and the chief medical officer of in vitro diagnostics at the U.S. Food and Drug Administration. Prior to her work with HHS and FDA, Sara served as the Senior Policy Advisor on Health and Biomedical Innovation at the White House Office of Science and Technology Policy, and was Associate Professor of Nanobioscience at SUNY Polytechnic Institute College of Nanoscale Science and Engineering. Our second panelist is Rajeev Sehgal. and he's the Senior Director of Informatics for BD Integrated Diagnostic Solutions. Rajeev led the development and commercialization of COVID informatics solutions for BD Veritor System Rapid Antigen Tests. And Rajeev also led the development of partnership with Image Mover to offer a digital solution for point of care COVID-19 testing. So very excited to have you both join us today for this panel. First, I wanted to start with Sara. Since you got a chance to see firsthand how these solutions were developed during the tech sprint, what are your overall impressions on the role and value of these tools? What are you looking forward to seeing as these as these markets, as these products go to market?
Awesome, thanks, Sophia. And I love your magnolias, so I love that background. We're looking forward to a lot of things in spring. So as I was listening to the review of the product, some of the highlights and the features that people have really driven to market over a very short period of time, I was getting excited all over again. I think that, looking at the role and value of what people have been able to produce, one of the things that stands out to me is improving care for patients and making care more accessible, in this case for diagnostics and for COVID-19, which of course is playing a huge part of everybody's life right now. So, moving diagnostics from labs and clinics into a space there where people can use them more freely, more readily, and they can act on health information immediately is a turning point, I think, in diagnostics. So that's really exciting. In my opening remarks, I talked about some of the data challenges that are created by that innovation, but really, it's two sides of a sword, and every new opportunity creates challenges and vice versa. So I think that, in looking at what has happened over the last year and a half, that stands out to me. And the other thing that stands out, which many of the speakers and presenters remarked on, was the amazing way in which public and private entities pulled together and developed partnerships and friendships and really thought creatively and outside of their traditional lanes in order to rise to new challenges. So my hope is that, a lot of those things that we've learned, just a few of those, but many more, will really serve as the tip of the spear for how we can collaborate in the future, the speed and the pace of how products can be developed and regulated in the future. And we'll see sort of a new age of diagnostics that is far more akin to 21st century medicine. Those are some of the things that I look forward to.
Thank you, Sara. And Rajeev, given your role and perspective working at BD Integrated Diagnostic Solutions, what are your initial thoughts on these tools? And what do you hope to see as these products go to market, including the products that you guys are developing?
I'm actually very excited to see and hear what I saw this morning from a lot of innovation that has happened in the last 1 year, all the way from making testing more accessible, streamlining public health reporting, and basically helping people open up the economy, because that's what ultimately the aim is, that as we fight the pandemic, that how do we get back to at least some new normal, right? So even at BD, we have been at the forefront of COVID diagnostics, launching, we have PCR testing, rapid testing, and we even launched a mobile solution earlier in the year so that we can really help streamline all of those aspects. But looking at these solutions, it just makes me very excited that we are collectively really pushing the innovation so that we can really help drive that collecting the right data, making testing easy, accessible, no matter where you want to do the testing. And like Sara said, that testing is moving out of the traditional settings. It is happening everywhere, not just in the lab. So how do we make sure that people feel comfortable doing that and they can collect the right data, because the data is very critical. So for fighting the pandemic, so how do we make all of those things easier? And also a couple of things that I am hoping that BD can contribute, and also other partners in the industry can contribute, is how can we really use these tools in the underserved communities and also even outside of US, because the pandemic is not just impacting US, but actually at this point, much bigger problem outside of US. So how do we use and leverage these tools everywhere and really get this pandemic behind us?
Thank you. Yeah, it's really helpful perspective you shared. And Sara, back to you. I know you kind of shared this in your opening remarks, but why did you decide to use the TOPx tech sprint approach to solve the challenges with diagnostic data? And in looking back, what were we able to achieve through this more collaborative cross-sector initiative that wouldn't have otherwise been possible?
Yeah, so, we started out knowing we needed to do something to juice innovation here because all of the regulation and the requirements and the policy in the world still wasn't going to enable people to capture and report data, even if they wanted to, right? So there had to be a yin and a yang, so to speak. And so we were thinking about, how can we do some sort of sprints? How can we spotlight? What are the real technology needs that are being created by these untethered diagnostics? And we wanted a way to be able to spotlight and focus all stakeholders on what we saw as critical challenges and do it in a way that, of course, promoted innovation like we've all been talking about. So we did the Diagnostics Design-a-thon in the fall. And I was thinking, I knew, many of the folks who've talked today, including Drew and her colleagues at Census, and I knew from our previous top sprint that this was a great way to really nationally spotlight big problems. Of course, the previous one I did was in public health as well, and opioids, and I thought, this is even bigger. It's just, I don't know if you can really compare the two, but this is big for right now. And so anyways, I knew that the team was great. They were great to work with. They were very inclusive, incredibly professional, and a lot of fun. So we reached out, Kristen and I talked about it. We reached out and said, could we do this with TOPx? It was like kind of a new version of the top model. And it was kind of a no-brainer. Once we got together on the phone, we were like, this is what needs to happen. This is going to be awesome. What we were able to accomplish, there's so much, but just to try to highlight a few things, in addition to the products that you heard about and so many more that weren't even, on the agenda today because we couldn't fit them all in addition to actual concrete products on market and in people's hands, which is, of course, the big thing, this process is unique in that it allows us to introduce stakeholders to each other who otherwise wouldn't have met. And as you and others who work in the federal government know, we know a lot of things about what's going on in the different industries and the different sectors to try to meet national challenges. But these players don't always know each other. And we're not always allowed to introduce them to each other or unmask them to each other. So we needed a stage or, kind of an open door platform that was inclusive, where people could join, they could volunteer, they could create their own partnerships and relationships, and we could provide some, sort of light touch or structured support, including timelines, including access to different federal agencies and different subject matter experts. So TOP was really kind of like the perfect combination of structure and access to government and openness and transparency and come one, come all, let's solve big problems together. So it's perfect balance for the type of thing that we were trying to accomplish. And I think that, we're all really happy with how it went. So I'd love to hear what Rajeev's thoughts are too.
Yeah, me too.
As a participant.
Yeah, and I wondered, have you participated in efforts like this in a more co-creative approach, even though, as we talked earlier, how these are potentially competitors to each other, but as we said, that they can really accelerate innovation. So I'm curious your thoughts, Rajeev.
Yeah, meaning if you look at the last 1 year, when they say that necessity is the mother of innovation, I think it holds so true. If you look at last 1 year, the rate at which innovation has happened, whether it is pharmaceuticals, diagnostics, digital solutions, how they have been deployed, meaning you look at nursing homes and even schools, meaning they have never done this testing. And now they're doing testing with a lot of help from the government and the industry, meaning it's amazing what we collectively have achieved. But at the same time, the thing that, meaning I think about, and also when I talk with other people, meaning I talk about is that, meaning how do we build on all the great work that has been done? Like a couple of things I would like to highlight, meaning there's so much work done on what type of data should be collected, how should that be reported? So how should we, but right now the work has been done from a COVID perspective, but how do we continue that work and make sure that it becomes more generic so that hopefully, hopefully nothing bad happens, but if something were to happen, that we are not again trying to reinvent the wheel, but we can just use the same tools and use the tools that allow you to collect the right data and do the right testing in no matter where you are doing the testing, and collect and report the data where you need it to go. And one of the things, I think in one of the lightning talks, it was brought up as well that state authorities, meaning they're not used to getting this much data from so many people. That has been a little bit of a challenge. And if you really look at it for people like nursing homes or schools or travel industry, meaning they're not used to doing this testing. And now you tell them to do the testing, and now you have to incur additional cost to even report the data, meaning all of those things just become a burden, but we need all this data to do well. So one of the things which would really help everybody would be if we can continue the work on Waters or similar technology so that data can all get funneled to one place and then it get distributed to wherever it needs to go. That would be great. And then the last thing I'll mention, which is again, one of the things that we have seen very closely from BD perspective, just because of serving so many different types of customers, that as it comes to non-traditional customers like nursing homes, long-term care facilities or schools, I think it is a great opportunity for industry and government to partner so that we have the right resources so that these facilities can do the right level of testing. And they don't feel like that they're like a fish out of a pond that, okay, I need to do all this, but I have no clue what to do. So those are some of the things that at least I think about, that meaning with all the innovation that has been done, how do we build on that and do even better, because COVID is not done yet. So how do we continue to fight this thing? And then how do we prepare for future?
Thank you, Rajeev. Yeah, that's a really good point. And I think that kind of relates to the final question that I had, and maybe Sara can provide some final remarks in this panel on this, as well as then Rajeev. What lessons can we learn from the COVID-19 pandemic response that can be applied to other current and future public health challenges? So, you mentioned the opioid crisis as the previous work, but what are some other ones? I know something that we were talking about is potentially a tech sprint on mental health, or what are some of the topics that you have been interested in seeing this application be used?
Ooh, so there was almost like two questions, like what are the lessons learned and then how could we use the application? The lessons learned is the million, bazillion, quadrillion dollar question. I'm going to chew on that one for a while. We're going to be unpacking that bag for probably years. Number one, perhaps, is sort of a takeoff on what Rajeev mentioned, which is we can't be caught without the capacity to deal with another pandemic again. So how do we build from here to there as quickly as we can, learning along the way, in every which way, diagnostics, data, the whole thing, public health, infrastructure, it all. The second piece on, what other health topics could we look at with a TOPx type of solution? I guess the sky is also sort of the limit there. I'll fall back on sort of my favorites as a preventive medicine and public health physician, which is keeping healthy people well. And I was in internal medicine before preventive medicine. So if we were to pick, the things that are really, causing pain and suffering for Americans in terms of their health, it would be a lot of chronic disease and a lot of things that result from lifestyle choices. So I think it would be fun to, look at some of those things, major preventable diseases, and do it in a way that really empowers patients to use technology, to use data, to really be informed decision makers when it comes to taking care of their bodies. I won't give you just one because I don't know which one I would pick, but the general theme would be putting patients and physicians back into the center of healthcare and leveraging technology, just like other industries do. And healthcare has been a bit behind in that regard.
Yeah, thank you. That's a really good set of remarks. Thank you so much, Sara, for your time on this panel. And lastly, Rajeev, what are your thoughts on, what can we learn from the COVID-19 pandemic response? And what do you see are some potential places where we can apply these open methods to current or future public health challenges that you've noticed in the industry?
I would say that, meaning, like I was saying earlier, that meaning all the technology that has been developed, how do we continue to evolve it so that it becomes more general purpose, so that it can be used in any other disease space, even if it's not a pandemic? Why can't we use all of this advancement to help other disease states? And like Sara said, I think it's important to always remember that patient is at the center of everything, and then the caregivers, and then public health people, meaning those are the people that we have to make sure that these solutions are really serving. And as long as we continue to do that and learn from the things that meaning from the innovation that has happened in the last 1 year, how do we continue to evolve it to just make sure that we continue to see how these solutions can be applied to other situations and diseases as well?
Thank you so much for both of your time and what you are doing in this area of work around public health. To wrap up this panel, I did want to just share a few remarks on the advantages of using open methods like tech sprints and design-a-thons for addressing public health challenges. In my experience working at the USGS for, I can't believe, almost 10 years now, and more recently at HHS, I also co-chair the Federal Crowdsourcing and Citizen Science Committee since 2016, and also helped initiate a crowdsourcing unit at the Federal Emergency Management Agency, also known as FEMA. And just a shameless plug, please check out citizenscience.gov and challenge.gov, where our federal communities have provided examples and toolkits for people to understand, how do these open innovation methods provide advantages? And there are many advantages in open science and open methods when it's strategically implemented, but there are also situations where it can be inappropriate. So it's important to understand how it's best used. And at a high level, these open approaches accelerate innovation. It can increase cost effectiveness and efficiency and address societal needs by directly engaging all members of the public, including patients. I think it's a really important piece to public health. And as one of the organizers of the COVID-19 Design-a-thon and TOPx Tech Sprint, it was vital that we had user advocates like Shawn Laughlin, the police commander that spoke earlier, and various other key stakeholders directly involved in co-creating these solutions to ensure that they have real-world impacts and directly inform operational decisions, and that we can save some lives. So thank you so much for the time to be the moderator for this panel. I will bring it back to Anna to wrap up the session with our closing moderator. Thank you so much. And we look forward to working with you all in the future.
Great. Thanks so much, Sophia and panel. It is now my pleasure to introduce Dr. DJ Patil, who was appointed by President Obama to be the first U.S. Chief Data Scientist at the White House Office of Science and Technology Policy, or OSTP. At the White House, he led efforts to establish over 40 chief data officer roles across the federal government. He was instrumental in advancing then President Biden's Cancer Moonshot Initiative, making data sharing a pillar for accelerating medical breakthroughs. Now DJ is a board member of Devoted Health, a senior fellow for the Technology and Public Purpose Project at the Harvard Kennedy School, and an advisor at Venrock Partners. DJ's support of the Opportunity Project in 2016 goes way back to the beginning, and we're very, very grateful for him for helping making it a lasting success. DJ, we thank you for your consistent leadership in data science, data ethics, precision medicine, and open data for good. We look forward to hearing your incredible insights today. It's been a pleasure collaborating with you over the years, and we look forward to more to come. Please welcome me in welcoming Dr. DJ Patil.
Hey, everybody. Kristen, it is so good to see you. It's been way too long, and we were so lucky to have Kristen helping make many of those key things that she talked about real. She was an integral part of that. So thank you for all you've done, Kristen, and continue to do. So what can I tell y'all? I mean, what you all are doing is essential. It's critical. And let me just kind of give you a quick story about just a little over a year ago. A small number of us had the opportunity to just drive up to Sacramento in California and help be part of the COVID response. And when we got there, what we found is what I think many of us have realized over COVID is that there aren't a lot of tools. There aren't a lot of technology. Some of that's all been well documented. You know, we had to take these models and rebuild them and try to get them to be scalable so you could test out different scenarios. What would happen if you close down parks, if you shut down travel, try to get these assessments. And you're trying to build these things in real time. It's really hard to do that. It's incredible pressure. Thanks to really great partners and favors, honestly, that we called in, we were able to get those technology platforms built and scaled. And at the same time, they were really rudimentary. They're not what we need to manage a crisis of this magnitude. But there's something really special that I think we have to highlight if we look over what has happened over the past year and a quarter. Fundamentally, there's a new layer of disaster responders, people who really show up. That's the citizen scientists, it's the technologists, it's all of you. I mean, it's fundamentally all of you. Several years ago, if you kind of said, hey, citizen scientists, people were like, what's that? What do you do? Who are these people? But look at what citizen scientists have done during COVID. Whether it's tracking data in novel ways and filling the gap from the COVID tracking project, modeling efforts like COVID Act Now, and so many others, augmenting and partnering with traditional academics, those in government, we've seen a real full force, all in approach. This is what so many of us have always dreamed about as being the opportunity and the vision of what citizen science can do, what technologists do when they have context of a problem, when they're let in to a room and had the ability to have impact. That's what we're seeing. But more than anything else, what inspired me the most during COVID, that beginning phase of COVID, is that we saw so many people step up and step in. They had day jobs, they took time off, some just work nights, some people work weekend, but everyone was pulling as a team. It was phenomenal. So many things got created, so much got invented. And so that's the first part, is that y'all are part of a new model. And this model is the second thing that I need to tell you, is that this is the start, not the end. Oftentimes we think about these events and we think about these things, we go, great, where do we go from here? What are we gonna do next? What I would ask you and sort of point out is that looking through the projects, we're at that early phase. We're still in what we might call the prototyping phase, where we're prototyping for 1x, as we say. But we need to build for 10x, 10x the population, 10x the diversity, 10x the different use cases. And then as we learn and we iterate on that, we honestly need to engineer for 100x. Because the problems that we're facing, that we're discovering, what works in one state may not work in another state or city, but we can together learn. And when we learn and we figure out what's working, then we sometimes need to go back to the drawing board, sometimes make small iterations. But in all those cases, that learning is what allows us to get to the next iteration. We go from 1x to 10x, and then finally, we're engineering 100x solutions. Solutions that are broadly applicable, that don't just work in one community, but work in so many different disparate environments. Because we know that COVID doesn't care about boundaries. All it cares about right now is if you're vaccinated or if you take the right safety measures like social distancing and wearing a mask, if you're in those kind of regions that have higher case counts. We're seeing the direct impact. If you all hadn't stepped up, what would have happened? Well, we just can take a look at what's happening in India, what we've seen happen in Brazil, what happened early days in New York. That's the impact that you've had. And I cannot state that enough, and how important your work has been. And I say that having been on the front lines with many of the policymakers as they've struggled through these decisions and trying to figure out these tool sets. So that is a way of me saying thank you for what you've all done. So where do we go from this idea first of having this new incredible layer of disaster responders and citizen scientists and technologists to realizing that we have to, this is a starting point and we need to carry forward, and not just in COVID, but on so many other mental health issues, other models of care, so many different things. There's so many problems that we need to solve. The third part of this is we really need to push our solutions to work for everyone. So many of the projects and proposals that I've seen over the year, they work for one population. Oftentimes they work only if you've got really great connectivity. They often work in only certain neighborhoods, certain socioeconomic demographics. COVID doesn't care. It's a species problem. So what we need to think about is, what are we going to do to make those solutions work for everyone? And so a couple things. If you're working with data, remember the data points have names. Find out their stories, meet them, understand why things won't work or will work. For me personally, what was really important, spending time with the local public health officers to understand their pain, the problems that they're facing, what was happening when they get in front of city council members, when they're addressing a school principal or an angry set of parents because they're making decisions that may impact their children's schooling and mental health issues. Those are real things, and trying to understand all those sides. Equally important was understanding people who are essential workers, those that put food on our table, those that are in the fields, picking our crops, cultivating, growing. What did it mean for them? We say, hey, just quarantine. Well, what happens if you live in a multi-generational household? All those things, we need to go an extra mile to understand what's happening. That means oftentimes getting away from our computer. Sometimes it's just picking up a phone call. Sometimes it's visiting. But we have to get out of our local bubbles and into those communities to understand what's going on. And as was said during the panel, some of the most important things in the process is that way, because we also need to understand to make sure that our technologies work for us, not against us, because very quickly we can cause a lot of harm if we're not careful, and we need to think through those aspects. So let's make sure that our technical solutions, everything that we're working on, is geared to working for everyone. And so here's my ask as we go on from this event, we go into other things. Number one, remember, this is a team sport. We're all in this together. You may be working on one project, share your learning, share what works, what doesn't work, help each other, all of that. We are one big, giant team of teams. And we need to all be focused on that. How do we make each other better? Lift each other up, find new teammates, people who will challenge us, push us in each way. 2, don't stop. Do not stop. COVID has many more twists and turns ahead of us, and this will not be the last pandemic. We still have not had pandemic influenza. We have so much to rebuild. There's so many issues that we have to address. Please recognize this is a starting point, and we had a long road that we have to get through to really make the country work in this way that of the healthcare systems and processes that we want for our own loved ones. And then finally, push each other. Don't get frustrated. When somebody needs help, be that friend. Celebrate the wins. Be partners in this together. It's oftentimes super frustrating, as many of you know, it's super challenging. But at the end of the day, look at the amount of impact y'all are having. And so finally, let me just conclude with just a note of gratitude and say, honestly, thank you. Thank you as a citizen. I'm not in official service or office, but I want to thank you because what you all are doing is the foundation for change. And you're proving what technology and data and citizen science should fundamentally look like. And so just know that you have my gratitude. Thank you.
Thank you so much, DJ. We can always count on you for big ideas that inspire us to push onward. And I want to echo Kristen in thanking you sincerely for your ongoing support of the Opportunity Project and your continued leadership that has really helped this community to succeed and thrive over the years. We're so grateful for all that you do and really incredibly grateful for your time to join us today. So thank you from all of us. Now, in just the last 2 hours, we've heard from government and industry, COVID-19 test manufacturers, technology companies, and community leaders. To all these speakers, contributors to the sprint, and everyone tuning in today, we could not be more grateful to you for sharing your time and expertise and making this sprint and today's event so special. We'd also like to acknowledge a few people and groups that have made this all possible. Certainly want to thank Mike Morgan and the Ventana team for their work to make this YouTube broadcast possible, and Frank Rachal in particular. Thank you to the Census Bureau, HHS, and Data Robot staff who were critical to this work. In particular, I'd like to mention Jerry Hartano, Alex Wilson, Emma Brennan, Haley Ashcom Miller, Sam Potasnik, Jamal Cornelius, and Rachel Mello. Again, just to name a few of a very large team that made this happen. Thank you so much. Members of the public who joined the sprint demo sessions, and the experts who shared their expertise during the product advising workshop that we held. We could not have done this without you all, so thank you. Today is a testament to the incredible work of the tech teams and all of the collaborators of the TOP community, HHS's open innovation community, and our nationwide commitment to COVID-19 response. As we mentioned at the beginning of the day, this entire sprint was made possible not only through interagency and cross-sector collaboration, but also by a new resource called the TOPx Toolkit. The knowledge we've built at the Census Bureau about running effective data-driven tech sprints is now available to the whole interagency and civic tech community through this resource. We are committed to sharing it widely and helping any agency use the TOP model to address their most pressing challenges and bring a new way of working to bear in their agencies. The tools that you saw today are evidence of what can be accomplished through approaches like this. TOPx is flexible and adaptable, and along with the support from our team at Census, it can be used to address policy priorities like health, education, housing, employment, economic development, disaster response, climate, and more. What topics are tackled next is really up to you. We hope that any government agency joining today will adopt this approach, and please get in touch with us if you'd like to learn more via opportunity.census.gov. Tech companies, universities, advocates, nonprofits, anyone else joining today, we'd like to invite you all to join our upcoming sprints. There will be new sprints taking place this summer and fall, led by many different agencies using this model. So please sign up for updates or get in touch with us to learn more about what you can do. Like so many of the speakers have mentioned today, this is about everyone coming together to solve our biggest problems, and we would love to work with you. Today offered such a great example of what is possible through TOPx, and we hope to collaborate with many of those who are joining today in the future. But the day is far from over. Please make your way over to the Hop-In platform next for interactive live demos with 12 technology teams and test manufacturers BD and Ellume. You'll have the chance to engage with each of them directly, see their products firsthand, and ask questions. To view the live demos, you'll need to make an account on Hop-In using your email or social media, but it should only take a few seconds. We really encourage you to join. It's such a great opportunity to really get up close with the teams and interact with them after seeing all of their amazing work today. Again, thank you all so much for joining. I hope you enjoy the live demos, and on behalf of all of our teams, thank you again.